Hello, I'm Cameron Sabat, and this is Cutting to the Case with Dr. Niall Boyce. And he is a trained physician, editor, and global health leader, currently serving as senior executive editor at The Lancet, one of the world's most influential medical journals. He previously served as editor-in-chief of The Lancet Psychiatry, where he led coverage and commentary on mental health, neuroscience, psychiatric ethics, and global healthcare systems. Alongside his editorial leadership, Dr. Boyce has held senior leadership roles at the Wellcome Trust, one of the world's largest biomedical research foundations, working at the intersection of science, medicine, and public policy. Trained originally in clinical medicine, his career is focused on how medicine, scientific communication, and global health shape society at large. Today, Dr. Boyce is widely recognized as one of the leading voices in medical publishing and global health discourse, helping shape conversations around psychiatry, public trust in science, healthcare ethics, and the future of medicine worldwide. Thank you very much for joining us today.
Thank you, Cameron. It's a pleasure.
Yes. So, yeah, uh, I wanted to start out this interview by asking about, research, which is really at the core of what the Lancet is here for. And I'm curious, medicine increasingly measures what's quantifiable. Now, in your view, what important aspects of human suffering do you think modern healthcare still fails to capture?
Well, I think that's a very important question because one of the things which has been very prominent at Lancet Psychiatry, which I used to edit, and at Wellcome, and indeed the Lancet group as a whole, is this question of lived experience. It's not just the quantifiable primary outcome of a study, which is important, but it's also what's the actual experience that someone's having. And I think that's particularly acute in things in areas such as mental health, where a lot of the time, necessarily so, we deal with checklists from diagnostic manuals, we deal with various instrumentalized ways of looking at conditions such as depression or psychosis. But within these diagnostic frameworks, within these checklists, what have we missed? Because so often these things were compiled years before anyone had heard of lived experience, years before that engagement was really thought of as anything important. So it's always very useful to think back and to say, well, what is it that the people are going through? How would they describe it? What's the important outcome to the patient? And that can often yield very good quantifiable results as well. So, for instance, I remember in the Lancet Psychiatry some years back, there was a paper which I published by a sort of philosopher, among other things, on the nature of psychosis. And this person, their contention was that the nature of psychosis had been sort of passed over through the general process of research, such that we weren't maybe devising the best psychological and psychosocial therapies because we weren't actually engaging with what the experience was really like. And often when you go back to these qualitative studies, I think clearly there's an ethical imperative to listen to people in itself, but also that's the kind of thing which in turn will lead these quantifiable advances in health as well. So I think I'd reframe your question a little. I wouldn't say that it's a case of the quantitative versus the qualitative, but it's looking at how the two can really complement each other.
Yes, and yeah, I really appreciate that response and really looking at kind of the biopsychosocial approach, I think is what's called in psychiatry is really important. It's a holistic approach to understanding the human condition. Now,
Yeah.
you've
Oh
also,
no,
yes,
with that to that. Sorry, that's something which I think is important for medicine as a whole. That besides my work at the Lancet, one of the other things which I'm very interested in is Renaissance culture and Renaissance medicine, and what thoughts people had about how the body and the mind worked 400 years ago. And if you look at that, you see something very interesting, which is that hundreds of years ago, certainly in Europe, and I'm sure in other parts of the world, the idea was that that the body was a whole entity, that everything in the body, every system was integrated with every other system. Body was integrated with mind, and that in turn was a subset of a greater whole, which informed the way in which the body worked. The body was kind of porous in a way that maybe we don't think of now. Now, of course, 400 years ago, they didn't know about neurons or microvasculature or anything like that. So you could argue that factually they had a long way to go, but conceptually, I think that they maybe were closer to the truth of how things work than we are today. And I think, as you say, the biopsychosocial model is one way of putting it. But I think one of the things which medicine has maybe lost as it's become increasingly specialized and siloed is the idea of how the body and the mind work as a whole, and how, as individuals, we're not little sort of encapsulated, siloed beings, but we are part of our environment, how our environment affects us and how we affect the environment. This is as much the business of medicine, I think, as are brain cells and blood vessels.
Yes, absolutely. And it's really taking that, long lost tradition of taking all of these factors into account. Um, and you've also spent many years deciding which scientific ideas receive
Mm.
global attention. And I'm curious, I mean, how do you recognize when an idea, like what you mentioned here, is
Mhm.
genuinely paradigm shifting versus simply fashionable?
And that's a good question. And I think that's something which journal editors have to consider very seriously. Now, there's one argument which I think is a very valid one, that the nature of journals means that they tend towards small c conservatism, that they won't publish anything that's too radical or too out there. But then the other problem is that when you've got a trusted brand, if you like, if you've got a Lancet or a Nature or a New England Journal, you think, well, am I giving the imprint and the weight of this very prestigious name? Am I giving that to something which is more hype than it is hope? So this is, I think, a duty which weighs on every editor. You don't want to get in the way of innovation, but neither do you want to give people false hope. Now, the way I think in the end that you have to manage this is to very carefully assess the strength of the evidence, to have maximum transparency as to the limitations of what you're publishing. Sometimes, you have to look ahead. You have to say, well, there might be something in this. It might pan out. Sometimes it doesn't, but sometimes it does. But yeah, there will always be some uncertainty. I think you can minimize the uncertainty by paying very close attention to the evidence. I think you've got to be very careful how you couch things, how you frame things, especially now. Because medical journals are no longer the province of the professionals. It used to be that you'd only see the Lancet in the medical school or the hospital library. Now anyone can access it online, so you've got to be very careful about how you frame things. But yeah, it's a difficult balancing act. There'll always be uncertainty, but that's part of what makes the job so exciting, so interesting.
Yes, yes, of course. And yes, it's a certainly a very interesting role to have because scientific journals have enormous gatekeeping power here as well.
Hmm.
I was wondering, how do you personally think about the ethics of deciding which voices
Hmm.
and ideas receive legitimacy?
And the ethics, that's clearly a very, very interesting and important question. And one of the important things as well is are we only looking at voices from certain settings, voices from certain communities? Are we consciously or unconsciously prioritizing perspectives which have always enjoyed great privilege and not really neglecting the rest of the world, neglecting the rest of the community, and therefore not really addressing the problems which affect so many people? So that is a difficulty. That is something which I think very consciously we have to address. We have to say, to what extent are we staying within our zone of knowledge, our zone perhaps of comfort? And I think we have to always actively challenge ourselves to get outside that. And yes, one way of seeing it is gatekeeping. The other way of seeing journals is as platforming. And personally, I've always seen the role of being a journal editor as being a little bit like a stage manager, that you're there to set the stage, put the lights up, and then let these wonderful researchers really present what they have, while you yourself stand somewhat backwards in the shadows in well-deserved obscurity.
Sure, sure. That's very humble of you to say. I mean, with such an enormous role, to be able to say that you are someone who's behind the scenes almost, and
Mm.
letting others speak. Uh, so I I also kind of building on that idea of different viewpoints. What's a belief that's widely accepted in medicine today that you suspect future generations of physicians may look back on critically?
Oh, well, this is a belief I'd say that is maybe beginning to crumble. In fact, I think it's in a fairly advanced state of crumbling, and this relates to my own specialist area of mental health. And I think this is the idea that we've always had that mental health treatments need to go via the head, need to go via the brain. We've now discovered, thanks to the wonders of medical science, that the head is attached to the rest of the body through the neck, and it's been fantastic over the past 10 years to see treatments and elucidations of mechanisms which go beyond the idea of the brain
Mhm.
in terms of mental health. So one of these would be the role of exercise and the great role that exercise can control, it can exert in controlling depression. We're also now looking at the role of microbiome, the role of diet, very importantly as well, the role which inflammation and anti-inflammatories might play. So if you were to look at mental health up until 15, 20 years ago, the whole idea that you'd say we can come up with a mechanism or a treatment for a mental health problem that is somewhat outside this idea that you're giving sort of therapy, you're passing information in and out of the brain, or you're giving a specific medication which will bind to a site in the brain, that there are other things which you can do which focus on the body. That would maybe not have been such a popular idea. But increasingly, I think that that is popular. And to relate to what I said earlier, I think that kind of integrative approach to mental health and physical health can only be to the good.
Certainly, certainly. And about this idea of kind of focusing on perhaps the wrong area of the body or the
Mhm.
wrong modality of treatment. Do you worry that healthcare systems are becoming technologically advanced but philosophically hollow?
Yes, and I think that one of the difficulties there, if you emphasize too much the technical, is that you do lose the wisdom and the humanity, and you lose a lot of the role of what the physician does and what the nurse does, or what clinicians in general do. Now, if you think about it, we've only really had evidence-based treatments with, knowledge of numbers needed to treat and so on. We've had that for a comparatively short time span, decades perhaps. Yeah. And yet there has been the need for the physician. There's been the need for the nurse. Long before that, that people have always needed someone who is able to look at mental health problems with a kind of boundary yet professional compassion, and is there to support and is there to advise. We've always needed that. We've needed that for thousands of years. That's something which is common in civilizations all over the world. So clearly, there is some sort of social cultural role for a physician besides the numbers needed to treat and the technical advances which you've spoken about. And I think that's a very important role. When I was at medical school, I remember there was a long and rather arduous course which we started off with on pathology. And one of the intensive care experts there presented a case which was of someone who had sepsis. And it was one of these interactive teaching sessions where you went through every sort of diagnostic and treatment option. And the case ended, as sadly some cases of sepsis do, with everything failing. And he said, "Okay, so what do you do now?" And no one in the lecture theatre had an answer. We were all in our early 20s. We didn't know anything about anything. And he said, "This is now your job to bind up broken hearts." And I think that if we lose that, then we've lost an awful lot in this profession.
Certainly. Yes. Yes. It's really the again the holistic approach to this. And this is
Mhm.
the one thing that makes me very interested in psychiatry as a medical student, really is
Mhm.
the idea that it's the one place, it's kind of the last frontier in medicine where you can sit down with a
Yeah.
patient for a good amount of time and speak with them about their problems. Now, this brings me to the kind of technologization of healthcare and
Mhm.
artificial intelligence specifically.
Mhm.
I was curious, what's the most unsettling implication of AI in healthcare that people are still not taking seriously?
Oh gosh, well, I think there's good and bad in this. I think that I'm not a total AI skeptic. I do also acknowledge the risks. And some of these risks, I think I'd be slightly meta in answering your question, in that I'd say the biggest risks are the ones that we can't anticipate. Now, one which I couldn't have anticipated is that I'd always thought of AI and the idea about AI, perhaps being used to deliver psychological therapies, which is an idea. I mean, there's plenty to be debated as to the practicalities and the ethics of that, whether that's something that people really want and are comfortable with. But certainly, there is the idea touted around of so-called no human in the loop systems and the notion that you could really use AI to massively scale up sort of cognitive behavioral based therapies, which all sounds great, but that's one of those cases where my eye in thinking about this was so much on mood disorders that I didn't actually think about psychotic or quasi-psychotic experiences. And then seeing these reports about people who do seem to develop bizarre and sometimes harmful beliefs through interaction with AI, that's something which I didn't anticipate. I simply didn't see that on the map at all in the way that I was thinking about AI in mental health specifically. Now, clearly, a lot of work needs to be done in figuring out what's going on, the extent to which this really is a problem. And I have to caveat that very heavily. But that's an example, I think, of how I think the biggest risks of AI are the things which we don't quite anticipate. They're areas where we don't really know how this thing entirely works, and we don't entirely know how the human mind or the human body interacts with this thing. And we need to be extremely vigilant in collecting adverse events and risks. Nothing is risk-free in medicine, but this is this is one of these areas where, again, to repeat, I see great potential, but also potential with caution, I think.
Certainly, certainly. Caution is always warranted. And I was kind of as I want to be respectful of your time here on the interview.
No, it's
So I
fine.
have maybe two or three more questions.
That's
Um,
fine.
what do you think the public most misunderstands about uncertainty in science?
I think what the public most misunderstands is that there is uncertainty in science, actually. Um, and this is something where I think we need to be very careful as communicators in how we talk about things, which is how can we honestly communicate uncertainty? And this is difficult because the anti-science voices are full of passionate intensity, as it were, that there's a degree of certainty and people are more comfortable with certainty than uncertainty. And I think that's the way that our minds and our brains work. And if you're there saying, okay, this is what we believe right now, of course, everything is subject to new evidence and modification, that sounds a bit less weaker than someone who's just giving you, straight up self-assured advice. But nevertheless, we do need to be honest, because I think that without that honesty as to the uncertainty of our process, without being able to communicate that clearly, I think that we do risk then being discredited when new evidence emerges. So it's not just a matter, I think that yeah, it's a matter of being able to communicate uncertainty transparently and using that perhaps as a way to establish a greater trust.
Interesting. Dr. Anthony Fauci is on faculty
Yeah,
actually here at
yeah.
Georgetown. And,
Mm,
one of the things that we were discussing is the idea that communicating uncertainty in a population that doesn't value, in a news system that
mhm,
doesn't value nuance is challenging when you're trying to assume an authoritative role and
mhm,
communicate guidelines
mhm,
effectively and clearly while the evidence changes week to week in the midst of the COVID
mhm,
vaccine outbreak. Now,
mhm,
with an impending potential hantavirus outbreak and future
mhm.
infectious disease disasters, I'm curious how you kind of balance that as a journal editor, as a producer of knowledge, how you balance communicating uncertainty with the public with the authoritative nature of guidelines, with the fact that the guidelines change and the evidence changes week to week.
Yeah, and this comes down to one of my favorite things, which is living systematic reviews. And I think that this is an area where evidence synthesis, I think, is a very important part of the future of medical science. I think there has been a proliferation of data. You look at any graph of the number of scientific papers written and submitted, and it's always going up, extremely steeply going up. So I think that the ability to really synthesize evidence is going to be key. I think that this is something which we weren't able to do before because we simply didn't have the technology and the means to do it. So maybe things like AI can help here too. But I think the joy of new forms of evidence synthesis is we can synthesize evidence in a living way. So we can come to conclusions where we have the greatest degree of confidence at this point. I think then communicating that to people, though, is the challenge. That's something which I don't think there's an easy solution to. But ultimately, I do hope that building that relationship of trust and of honesty is important. But also, in the end, you gain trust through the results that you show. You gain trust by focusing on what matters to people and delivering in those areas, in health as much as in anything else.
Yes, yes. Really approaching from a partnership and not a patronizing standpoint
Yeah,
with,
yeah.
yes. So my my final question to you really is if you could anonymously ask the global medical establishment one uncomfortable question, what would it be?
I think it would be whose interests are you prioritizing? And
Hmm.
I don't mean that in a sort of
Okay.
conspiratorial way. I mean
Yes.
that as in what what are you researching? What outcomes are you chasing? Who sets those outcomes and those priorities? Are these the things which really matter to the people who are affected? And how do you know that these are the things that matter? That's the very simple question. And I think that it's very easy to get into a cycle of the funding grant, the journal publication, the conference presentation,
Sure.
and for that to become a sort of cycle. Yet we
Yes.
also need to remember that reality continues, the world continues. People who are suffering and distressed need help. Uh, what do they need? How are we going to provide it for them? How do you know that that's what you're doing? I think that's the uncomfortable question that I would ask.
Yes, thank you very much. I very much appreciate your presence here, and your time and your thoughtfulness in responding to these admittedly very tough questions here. And yes, if there's any last, information you'd like to share with the audience about the Lancet or about any advice you'd like to give to the audience, um, now's a fantastic chance as well.
Yeah, what I'd say is that it's very important to make your voice heard. That if you are experiencing ill health, physical health, mental health, it's very important to look at organizations like the James Lind Alliance, looking at places that you can make your voice heard, you can set the priorities, and that you can really work in partnership with researchers, with clinicians, because I think that the way forward, as the pandemic demonstrated, actually, it's something which we all have to work together on health. It's something where we have to cooperate, where we have to cooperate respectfully, and I think that that's the way in which we will further advance this profession and this science.
Yes. Thank you very much. What a wonderful message to share. And feel free to watch Cutting to the Case on YouTube or Spotify or however it comes out. And yes, again, I really appreciate you joining.
Thank you very much.
Thank you very much.